Okay, so just one more thing. So when you take a look in this picture on the right of the lateral ventricle on top, and you see the little red, the choroid plexus. So except for that area over the choroid plexus, the rest of the lining of the ventricle is freely permeable. But when we're looking over that choroid plexus, that's where we have this tight kind of security system that keeps kind of unwanted things from getting in. So let's take a closer look. So when you look at the circulation of the cerebrospinal fluid, so it's again made by those capillaries from the pia called the choroid plexus. The ependymal cells are a kind of a specialized endothelial cell. They are kind of cube-like or rectangular in shape. They are kind of snugly positioned right side by side, and they create these tight junctions over the choroid plexus. And the ependymal cells block the passage of kind of water-soluble molecules between the blood of the brain and their cerebrospinal fluid. It transports other molecules, the ones that we want inside, via facilitated diffusion or active transport from the blood to the cerebrospinal fluid. So those ependymal cells are really a critical part of what we call the blood CSF barrier. So the blood CSF barrier is part of the blood-brain barrier, which we're going to talk about a little later too. So the ependymal cells are responsible for limiting unwanted or dangerous toxins from coming into the bloodstream and making their way into the cerebrospinal fluid and therefore having contact with the really important nervous system. So I took the picture here and kind of just tried to blow it up so you could see it. You could see the choroid plexus as it sits inside and pushes the cerebrospinal fluid through. We might have better pictures in the other A&P books too, but I wanted to stick that in there just so it'd be more visible. So let's take a closer look at the ependymal cells. So here we have the ependymal cells in the top right picture. Again, they are a specialized endothelial cell. They have the little cilia or the microvilli. They help circulate. So the ventricles, these ependymal cells both help secrete the cerebrospinal fluid, but they also circulate it. They also push it through with the little cilia. And again, the ependymal cells also remove waste products from the cerebrospinal fluid. And again, they are critical in blocking the passage of water-soluble molecules between the cerebrospinal fluid and the blood from the brain. They do allow some molecules to be transported between the cerebrospinal fluid and the blood. Let me see if there's anything else I wanted to say here. Again, if you take a look at the ependymal cells, those are like the cube-shaped specialized endothelial cells. Okay. So I put in this picture. This picture is from the Saladin Anatomy and Physiology book. That's one of our textbooks. And it shows, I know it's hard to see here. I'm hoping it's a little dark. I'm hoping in your slideshow, in your house, you can blow it up and see it a little better. This picture I thought was good because it shows kind of a step-by-step flow of the cerebrospinal fluid. So like number one is where the cerebrospinal fluid is being secreted by the choroid plexus and in the lateral ventricles. And then it's flowing down into the interventricular foramina, into the third ventricle. And here in that third ventricle, in number three, you can see the choroid plexus that exists in the third ventricle. You've got more cerebrospinal fluid being made here, and then it's coming down into the fourth ventricle. There's at number five, you can see the next choroid plexus in that fourth ventricle adding more cerebrospinal fluid. And then it's traveling down. And in number 7, it's flowing into the subarachnoid space and kind of bathing both the brain, those external surfaces of the brain and the spinal cord, and then it's flowing up and around. And in this picture, the darker blue is showing how after it comes up, it's near number 8. You can see here it's coming out. That's kind of the used cerebral spinal fluid coming out through the arachnoid granulations and being reabsorbed into the venous system of the brain. The veins. Venous system just means the veins of the brain. So that's where it's meeting up with the other deoxygenated blood from the brain. So I just thought it was a good picture kind of showing you step by step. This is a brighter picture, so I think it was easier to see, but it's similar without the numbers. I thought the numbers were helpful. But again, here the lighter blue fluid is showing the flow of kind of the new cerebral spinal fluid that's been made and flowing through the system. And again, the dark blue is showing kind of the used cerebral spinal fluid being reabsorbed back into the brain's venous system to be recreated, recycled, so to speak. So why do we care? Why do we care about the cerebral spinal fluid? Well, cerebral spinal fluid provides really important clinical information, right? So except at the choroid plexus, the ependymal lining of the ventricles is freely permeable, which means the cerebral spinal fluid is in constant chemical communication with the interstitial fluid that surrounds the neurons and the neuroglia. So if those neurons and neuroglia start to malfunction, and they start to detect central nervous system misfunction or dysfunction, it can produce changes in the composition of the cerebral spinal fluid. So if you were a physician and you wanted to know what's going on in somebody's central nervous system, doing a spinal tap or a lumbar tap and taking some of that cerebral spinal fluid out, it would give you some really important clinical information. So spinal taps can provide useful clinical information about an injury to the central nervous system, an infection, a disease. So that's why physicians are often going in to do spinal taps. And again, when we talked about the spinal region, they tend to go in with these needles low in the lumbar spine because they want to avoid hitting any important nerves, right? And what do we know? Low in that lumbar spine, we have the cauda equina, so there's more room, and those nerves have room to move away from an incoming needle. So that's really why one of the reasons why cerebral spinal fluid is so important clinically is it tells the story of it tells part of the story of how a patient's central nervous system is functioning or firing. And again, so cerebral spinal fluid, about 500 milliliters of this is secreted every day by us. But only 140 milliliters are in the system at one time. So it's constantly being recreated and moving through the system. And then when kind of it cycles through again, it's reabsorbed back into the venous blood by those arachnoid granulations. It's the same picture that I popped in here on the right. And again, those arachnoid granulations are projections from the arachnoid matter that come up and pierce into the dura mater, into the venous sinuses. So this is an example of example of the superior sagittal sinus here on the right. So essentially, those venous sinuses drain the brain of the deoxygenated or used blood, as well as cerebral spinal fluid. So again here, the three big purposes that the cerebral spinal fluid serves are buoyancy. The brain and the cerebral spinal fluid are the same density. So the brain is suspended in the cerebral spinal fluid, so the weight of the brain doesn't rest on the floor of the cranium and damage the tissue. It also protects the brain from striking the inside of the cranium when that head is jolted. It also helps with chemical stability. So the cerebrospinal fluid rinses metabolic waste from the nervous tissue, and it regulates chemical environment. And slight changes in the cerebrospinal fluid composition can cause a malfunction of the nervous system. So an example of that would be all of a sudden if you had an increased pH of the cerebrospinal fluid, it can cause things like dizziness and fainting.